I'm a physician who did all this studying. I'm in the optimization world, and I did not know about this until this year. How is this? How come this is not
This
being
is a common
accepted
thing that
more
you
for
see in a lot of
cardiologists?
physicians, I'm assuming, too.
It's very, very common. The American Heart Association was, we published what's called a scientific statement in 2002 under the auspices of the American Heart Association about omega-3 and heart disease, because it was the heyday. Everything was pointing in the right direction. This stuff is great. The blood levels are predicting outcomes, and that's where the American Heart Association actually allowed a paper with their banner to say supplements are okay, which they hate to do.
Yes.
They hate supplements. Yes. Even if they're good for you. Sorry, AHA. If you're good. I know nobody in your group is going to watch this thing.
Yes, exactly.
And then again, these studies kept coming on. Some of them were failing, and the American Heart Association is more of a doctor-related thing than a public. And so the doctors started getting, well, maybe just tell people to eat some fish. We don't need to tell them to eat supplements because we don't want to do that. And that's not enough. So American Heart Association is not a big proponent of. There isn't a statement from them now saying you need to measure omega-3 levels. I really think there should be, but they think you should measure cholesterol.
Yeah.
But omega-3 levels are more predictive of outcomes than cholesterol is.
Look at that. So, if I may throw a monkey wrench on here, and Doc, I need your help on this. So, we live in a culture where they measure cholesterol and they put the fear of God in you that you're going to die of a heart attack, right? And cholesterol is a very complicated subject. So a lot of people, in my opinion, get placed on statins inappropriately. Like, it's just the incorrect medication at that time. Now, there's no question that statins work and they've saved millions of lives and all of that, but they do have consequences as well. What is your view on, based on this conversation that we were just having with the American Heart Association, someone who gets this prognostic test, sees it, and says, okay, so if I make some lifestyle choices, if I start changing some things and I do this testing, I can actually not have the need to use these medications. Do you see a correlation or a link there?
But let me ask something before this,
please.
because what I liked what you said is the omega-3 index is not just a diagnostic test, which your cholesterol level is. The omega-3 index is a prognostic test. If you do a cholesterol level, your LDL is high, they'll say you have dyslipidemia. So that's a diagnosis.
Right.
It doesn't always give you the prognosis of your risk of heart disease as well as the omega-3 index gives you.
No.
This is profound.
Right.
Yep.
And this is, again, I'm not going to say accepted by the American Heart Association, but they agreed that this was a prognostic test, the omega-3 index.
Yeah, right.
Very
And I love it you mentioned hyperlipidemia so the fancy name. I have a friend who made this name up. I wish I'd made it up. It's called omeganemia. Omeganemia.
I love that. That's going to be in our...
Mike Gross, that's for you, Mike. You have omeganemia.
And it is more of a prognostic factor to heart disease or other cardiovascular
Right, and
related
cognitive
problems.
dysfunction. I mean,
Cognitive
lots of things.
dysfunction.
So again, the question is,
We're going to help you explain
if I
that
do
word,
this
by the way.
test,
Omegalemia,
and I change my lifestyle and put the right things in place, is there a possibility for me not to have the need of these medications?
I wouldn't go that far.
Okay.
I don't know.
Yes.
To say
Good-
that.
good
I don't
point.
know.
answer.
But it certainly doesn't lower cholesterol in the same way a statin does. Can you reduce your risk for a heart attack to the same extent by normalizing your omega or optimizing your omega-3 versus optimizing your cholesterol? It's hard to test that. Hard to say. But I wouldn't. Yeah, I wouldn't want anybody to think I'm saying stop your
Yeah,
statin.
no, me neither. Me neither. I just, again,
But I
I'm
believe that
spitballing.
back in the 80s, maybe you were around to experience that the cholesterol bracket used to be 260. Like that was the number, and they brought it down to 200. And now all of a sudden people need statins, left and right. So back in the days we were pretty healthy and it was 260, and now they brought it down to 200. We don't have to rabbit hole down that, but
Inflammation. And I think for me, statins, we had a patient the other day who said, they push statins, but there are a lot of long-term studies that show that statins do decrease risk of cardiovascular disease and decrease risk of heart. And I think it's not because the level that decreases your cholesterol. It is because it also decreases inflammation. And when we think about the omega-3s, it's not just that it decreases blood pressure, decreases heart rate, but also decreases inflammation. And if we compare our population now compared to 60 years, 80 years ago, what we didn't have back then was all the chronic silent inflammation. So I think inflammation is at the base of most of our chronic diseases, and our toxic world now makes it that we're more. So yes, doctors are like, wow, we're so much more toxic, we need less cholesterol. But at the end of the day, I think we need less chronic inflammation. How do you decrease that? I think omega-3s are a very big part of it.
So it's definitely complementary.
But I wouldn't, I think probably back in the 50s and 60s, there was plenty of inflammation going on too. And a lot of smoking, and a lot, I mean, there was, so it was bad in everything.
Started already.
Everything was bad.
But now, no matter what, our health, compared to even back then, I'm not saying those were the golden years of health.
No.
But this was definitely our toxic world. I did a talk yesterday on endocrine disrupting chemicals. And how much this is creating a havoc. And again, it's not one thing. It is the combination, the synergy of all those horrible things that are happening in our toxic world. And each generation is getting worse, unfortunately.
Right.
So basic things we can do to try to help this. Nutrition, I always say that's the lowest hanging fruit of wellness.
Right.
This is where we can make the most impact.
That and exercise.
Eating better, yes. And then omegas and the omega-3 index. By the way, when those guys were telling me about all this, I was always, too much noise, rancid oil, fish oil. This has been so amazing. I want to go over the testing.
Yeah, I think it's a good time.
We have a lot of friends, patients who are cardiologists, and it's amazing that I don't hear this being talked about until I came into the optimization world. Our goal and our mission is going to be to really push this.
We like to get a baseline and a follow-up. This is what I've been pushing. This is why we're here, manifested. I love that.
So for full disclosure, Dr. Harris has an amazing company that tests for intracellular, we just got into that, intracellular levels, omega-3, omega-6, which we'll discuss in the ratio of that, right? And trans fats. So I think it's a great time to go over our results.
I think we
have a little competition going on.